Please note, the opinions expressed in this podcast are those of the individual speakers and do not necessarily reflect the views of Tri-County Orthopedics. Any medical advice or treatment recommendations discussed should always be reviewed with your own healthcare provider. This podcast is not a substitute for professional medical advice, diagnosis, or treatment.
Welcome back to the OrthoZone Podcast, brought to you by Tri-County Orthopedics. Today we are joined again by Dr. Jonathan Shearin, who will be talking about CMC thumb arthritis. Welcome back, Dr. Shearin.
Thanks for having me.
To get started today, what is CMC thumb arthritis?
So CMC arthritis stands for carpometacarpal arthritis. So it's an arthritis in the hand, specifically at the thumb. So it's at the base of the thumb, also called the basal joint of the thumb. And again, CMC stands for carpometacarpal arthritis. So it's an arthritis of the hand specifically focused on the thumb.
Who is most likely to develop it?
So generally we see the prevalence of CMC arthritis increasing with age. So as we get older, we're more likely to have it. Some data shows that in patients over 50 years old, about 8% of men have the condition and about 25% of women have the condition.
Where exactly is the CMC joint located?
So the CMC joint is located at the base of the thumb. So if you can imagine your thumb, it's essentially where your thumb is meeting your wrist. So sometimes it can be confused for a wrist type of pain, but it's pain at the base of the thumb. So as you follow your thumb down, as your thumb is meeting your wrist, that's the basal joint, or the CMC joint, also known as the carpometacarpal joint. So specifically, it's where the thumb metacarpal is meeting the trapezium bone. Thumb metacarpal is meeting the trapezium bone.
Why is this joint so prone to arthritis compared to other joints in the hand?
So the CMC joint, the thumb CMC joint, or the carpometacarpal joint, really serves and has significant utility in the hand. The thumb is integral to many of the functions that we use in the hand, and often it is taken for granted. So a lot of times when we think about what the thumb can do, we think about the thumb really can move in several different positions. So we think of flexion, extension of the thumb. So flexing and extending. We think of thumb abduction or opening, and adduction, closing. And then we also think of opposition of the thumb. So as the thumb is opposing the other digits. So it's integral to everything we do from a daily living standpoint, from the time we get up in the morning to going to bed at night.
Is thumb arthritis just a normal part of aging?
Great question. I think as we get older, we can develop arthritis. When we have arthritis, we have a loss of cushion or we have a loss of cartilage in different parts of the body. I would say when thinking of thumb arthritis or basal joint arthritis, really the strongest risk factors for the condition are advanced age and female sex. And that's been shown and that's been studied. So female sex and advanced age. And as I said, 25% of women over 50 and about 8% of men over 50 have thumb CMC arthritis. Now, the good thing is that only really 20% of those patients who have CMC arthritis require treatment. So just because you have it does not mean you need treatment.
So now we're going to talk about symptoms. What are the first signs someone might notice that they have this?
So that's a really, really good question. I think there's a few things we have to think about. Number one, patients begin to notice pain at the base of their thumb. So again, the area of the thumb where it meets the wrist, the base of the thumb, you start developing pain in that area. Now, that pain is really worsened by those activities we talked about that the thumb is involved in. So flexion, extension, abduction, adduction, and opposition to the thumb. So we think about any type of pinching, turning a key, holding a glass of water, buttoning your button on your shirt. So when you have progressive pain at the base of the thumb that's worsened by pinching or gripping or turning a doorknob, opening a jar, that is suggestive of thumb CMC arthritis. What you can start to see as well from the patient and the provider standpoint is if you look at the base of the thumb, you can see what we call a prominence of the thumb. And what that means is that the base of the thumb joint starts to stick out, or it starts to become more noticeable, and you see a prominence at the base. And what that really is, that's the subluxation of the thumb, or that's where the thumb, as the arthritis progresses, the thumb loses some of the ligamentous support. When it loses the ligamentous support as the arthritis is progressing, you can see a bump at the base of the thumb, and that bump can be painful. As the arthritis starts to progress more, aside from pain and weakness, patients can begin to see a deformity at the thumb where you can develop a contracture, and then the tip of the thumb starts to extend out, and that's called a Z deformity. These deformities are classic for advanced thumb arthritis, and these are several things that patients can look for from a day-to-day standpoint.
What daily activities would become difficult with this condition, or are there any activities that would make it worse?
So I think any type of activity of daily living, such as brushing your teeth, combing your hair, turning a key to get into your home, holding a glass of water, these type of gripping or pinching activities are really what can become harder in terms of, number one, pain, but number two, when you lose the cushion at the base of the thumb and the arthritis develops and you lose the ligamentous support, the thumb can get weak. The thumb doesn't function the way it normally did. And these are some of the things that I look for in the office. If someone comes to see me and they're concerned about pain in the base of their thumb, all treatment is personalized for my patients. So we really have to look at the whole picture and determine, number one, where the pain is. Number two, how long have they had it for? Number three, how is it really interfering with their daily activities? And as we said, holding a glass of water, turning a key, buttoning buttons, opening up a jar, these are simple things that start to become harder because of weakness in pinching and gripping and also pain. And there's certain things that I look for when I examine the patient in the office that can reproduce these symptoms.
So Dr. Shearin, tell us how you're diagnosing this condition in the office.
So when a patient comes to see me with pain in their hand, focus on the thumb, at the base of the thumb, I'm considering basal joint arthritis, CMC arthritis. I get a thorough history, understanding when it bothers them, what time of day, what activities make it worse. And I like to get x-rays. The reason I like to get x-rays is that there are many different pathologies or problems in this area of the hand and wrist. So we want to ensure that we have the accurate diagnosis. X-rays often will tell the story. X-rays will often confirm my suspicion. Once we have those x-rays and we've taken a history and I understand what values the patient has, what they do on a day-to-day basis, what their hobbies are, I can then begin to examine them. And when I examine them, I'm confirming my suspicion. And so I look for that bump at the base of the metacarpal, which is the subluxation of the metacarpal. I also look for, is there any swelling at the base of the thumb? Is it swollen? Is it inflamed? And then I palpate the base of the thumb and assess if there's any tenderness or any discomfort. And there's specific maneuvers. In orthopedics, we have a lot of physical exam maneuvers and a lot of tests. And oftentimes these tests can be very helpful. One test is something called a grind test, where we essentially push the joints together. So as we mentioned earlier, the thumb metacarpal base and the trapezium, those are the main joints that comprise the CMC articulation, and I will grind those or push those together with an axial compression and a slight rotation, and that is a very good exam maneuver. That actually has a specificity of close to 100% in terms of assessing for CMC arthritis. The other maneuver is something called a traction shift test, which is basically pulling a little traction on the thumb and just moving the thumb up and down or subluxating the thumb to assess for any pain, discomfort, or instability. And that also has a high specificity. So these are some physical exam maneuvers that I look for in addition to my x-rays and my history.
And then do you typically want the patient to then go for like a CT scan or an MRI?
So oftentimes if the x-rays and history are suggestive, then we don't need a CT scan or an MRI for this condition. CT scan and MRIs can come in at times when the diagnosis is equivocal or there is some uncertainty, or I'm looking for possibly another problem or another source. So generally, the majority of the time, no further imaging is needed aside from radiographs or x-rays.
So for treatment options, what is kind of your first line of treatment with this?
So first line of treatment, after I've discovered the patient's hobbies, occupation, what they like to do, and how this is interfering with their life, we first talk about activity modifications. So what are activity modifications? So this is a form of conservative conservative treatment, and conservative treatment is the absolute first line of management for thumb, carpometacarpal, or CMC arthritis. And for activity modifications, what that is you want to try to avoid activities that make it worse. So try to use your other hand. Try to avoid the specific activities that are bothering it. Now, I know as well as any of my patients that it's difficult and challenging to modify your activities, especially if you do them on a daily basis, and especially if they're involved in activities of daily living. It's just hard to modify, but you want to try to avoid the provocative pinching. You want to try to avoid the provocative gripping maneuvers. And there are also specific ergonomic tools that you can get around the house to assist. There's different things that can help you open jars. There's different devices that can help you decrease the load that you're putting through the thumb. Then there's a list that we can hand out and show you that you can get for around the house that are ways to decrease the load and the forces that are going through the thumb CMC joint. So in addition to activity modifications, another significant first-line treatment is splinting. So generally splinting comes in a variety of forms. One is an off-the-shelf, a universal splint. Another is a thermoplastic or a custom splint that our hand therapist makes. Essentially what the splinting is doing, it's immobilizing or protecting the thumb joint and the carpometacarpal joint so that there's less forces and less stress going through that joint. And it's been shown that a thumb splint specifically geared towards CMC arthritis has been shown to improve both pain and function kind of in the medium time frame, which is about 3 to 12 months. And this is really important because we have these in our office. I can also provide you with a prescription to have one of our hand therapists make a thermoplastic custom splint. So I think splinting is paramount in order to manage this condition conservatively.
What role does hand therapy play with this condition, and are there any specific exercises that help?
So when I think of hand therapy for this condition, I think of this condition as being treated conservatively with really a multimodal treatment algorithm. And what that means is there's different ways that we tackle this. There's different ways that we approach this condition conservatively. So there are specific exercises, and these exercises really are proprioceptive type of exercises of strengthening the thumb, understanding the position of the thumb in normal day-to-day activities. And that's something that the hand therapist can guide you and help us with. So exercises can be important, splinting can be important, and there are other modalities such as different stabilizations that the therapist can provide, different specific maneuvers that the therapist can provide. So I think hand therapy, in addition to the other modalities, can be integral in terms of treating one of my patients with CMC arthritis.
Do anti-inflammatory medications also help?
Yes, I think non-steroidal anti-inflammatories can help and have shown to have a modest pain benefit in this condition. So that comes in the forms of anti-inflammatories such as Advil or Aleve, or slightly stronger anti-inflammatories which I can prescribe for you, such as meloxicam or celecoxib. These are stronger anti-inflammatories that can help, and I can provide you with a prescription for these. Also, over-the-counter Advil and Aleve work well. Additionally, it's been shown that a topical gel or a topical anti-inflammatory gel like a diclofenac gel or Voltaren gel can be added to the regimen in order to provide a pain benefit. So there absolutely is a role for topical or oral anti-inflammatories to providing pain benefit in this condition of CMC arthritis.
At what point should someone consider a cortisone injection, and how long do they typically provide relief?
That's a great question, Olivia, and I think that, again, this has to be a very personalized approach. So someone is ready for a cortisone injection when they've attempted all other treatments. So we've tried the bracing, we've tried the anti-inflammatories, we've tried the hand therapy, we've tried icing, and the patient still remains symptomatic and painful. And we can try cortisone injection. A cortisone injection we can do in the office. It takes me about 2 or 3 seconds to do, and this has been shown to provide short-term pain relief. I've seen pain relief. It's been reported between about 3 and 6 months of pain relief. I've seen patients get 9 months and 12 months of pain relief from one cortisone injection. Now, I've seen that there are other studies that have shown that not one particular injection, whether or not it's cortisone or hyaluronic acid or PRP, not one agent has been shown to be better than the other. So there's not one superior type of injection, but I can offer a cortisone cortisone injection, and that's definitely something that we will have as an option in our armamentarium once the other treatments have failed.
So if these treatment options are not working for the patient, when is it time to consider surgery?
I think when the patient has attempted splinting, attempted anti-inflammatories, attempted activity modification, have tried hand therapy, have considered an injection, they then can consider surgical intervention. I will say that most patients do not require surgery. This is a very personalized approach to my treatment, and we have to understand what are the goals of the patient. Are they happy with the pain relief they're getting from the splinting and the injection, or do they want to try something more? So I would say at the very least, surgery can be indicated when we've completely failed non-surgical management and they would like something more definitive for treatment of their CMC arthritis.
Is surgery only for severe arthritis?
No, surgery for thumb arthritis or CMC arthritis can be for moderate arthritis of the thumb or severe, or even there are options for mild arthritis. And so they come in different varieties. So when you think of a joint sparing or an extra-articular approach to thumb arthritis, there are different varieties of this. You can think of osteotomies. You can think of ligament reconstruction. Osteotomies is when you're reshaping or rebreaking the bone. Reconstructions when there's minimal arthritis, but there's only instability. There's also a newer concept called CMC joint denervation. So CMC joint denervation can be used for different severities of arthritis. And what that's doing is it's a surgical procedure where you're removing the nerves that are supplying the CMC thumb basal joint. By removing the nerves, the idea is that you don't have pain generated from the joint because the nerves to the CMC joint have been cut or removed. So that's called a CMC joint denervation. The upside of that procedure is that literature has shown it's about a 3.5 to 4 week return to full recovery or near full recovery. So the recovery is quicker for a CMC denervation. The downside, which I don't think is a huge downside, is the outcomes, successful outcomes, are about 70 to 80%. So it is an option we have without perfect outcomes that does not burn any bridges, but gives us a extra-articular joint sparing option with a quicker recovery for this particular condition. Now, when you think about joint sacrificing options or the mainstay of treatment for CMC arthritis, the most commonly performed procedure in the United States for this condition is something called a trapeziectomy with LRTI. And that's greater than 90% of cases you see a trapeziectomy with LRTI. And what that means is you're removing the arthritic bone, so we're removing the trapezium, and then we're reconstructing the ligament and placing a tendon to help fill in with scar tissue. So that is the most common procedure, and this procedure comes in many different varieties. The trapeziectomy is always the same. You remove the trapezium bone to treat this arthritis. But how you do the ligament reconstruction or how you do the suspensionplasty can come in a variety of fashions. And when surgery is indicated, really, as we said, the choice depends on how advanced the arthritis is, what are the demands of the patient, and also surgeon experience. There's some data that has said also that no particular surgical technique has been proven superior to another technique, which means that for this thumb condition, CMC arthritis, many different surgical options work. The most common procedure we've already discussed, but many different options work, and I would be happy to discuss with you further if we really have exhausted everything. There's been a newer topic on the market about CMC replacement, where you actually do a joint replacement. This is somewhat newer in the last 6 months. It's been around, but there's been challenges with previous implants in terms of revision rates. And there's new implants on the market, but they haven't really been studied enough yet for me to confidently say I can offer this to my patients. The issues and challenges with joint replacements for this particular thumb joint, the CMC joint, has really been the revision rate. When you have a revision rate, it means there's a problem that has to be addressed. And the revision rate for the implants have been up to 25%. So that's 1 in 4. So that's a very high number for me, and that's why it hasn't previously gained a lot of traction. But in terms of the standard common procedure, the trapeziectomy with a suspensionplasty, most common, and patients generally have been very happy with this procedure.
What does the recovery look like after surgery?
So for a CMC arthroplasty with a suspensionplasty, which is the common procedure we do, that generally is done as an outpatient. So it's an in and out. You come in the morning, you go home the same day. The anesthesia doctor will give you some twilight or some lighter type of sedation, and we do a nerve block for the arm where the arm is numbed up. And the procedure takes me about 40 to 45 minutes. You then go to the recovery room, you go home, you need a ride home, and then within 3 or 4 days, you're seeing one of our therapists. The therapist will make a splint for you, and you're in that thumb splint for about 4 weeks. But you're starting therapy during that time. So we begin therapy early. We get you back to using your hand early, and you're seeing the therapist once or twice a week. After you're in the thumb brace for about 4 weeks, you're then continuing therapy. I would say that full recovery for this condition is between 3 and 6 months. Full recovery. But that's a bell curve. So some people recover sooner than that. Some people, it takes a little bit longer. It's a highly successful procedure with successful outcomes being reported as greater than 90 to 95%.
How long before patients can use their hand normally again in that 3 to 6 month recovery time?
I would say you're using your hand fairly normally by 6 weeks, give or take. Some people sooner, some people a little bit longer. In terms of heavy lifting and heavy gripping, that's about 3 months. That's a little bit longer for heavy use of the hand.
Some general questions just to end on. What is the biggest misconception about thumb arthritis?
I think that's a great question, and oftentimes I'm presented to this in the office. I think the biggest misconception is that patients are under the impression that nothing can be done. They come in, they see me, doc, let's talk about this, let's talk about this. Oh, by the way, I have thumb arthritis and I don't think there's anything that can be done, or I've been told there's nothing that can be done. That's the biggest misconception. Between all the non-surgical treatment we've discussed, between all the different modalities that we have at our disposal, absolutely something can be done, and I would be happy to help you with this and go over this with you.
What is the most common symptom that people ignore?
I think the most common symptom they ignore is progressive weakness in gripping, pinching. I think pain. Patients don't like to live in pain. So pain is something that most of the time they complain of. The weakness in pinching and gripping, I think they can ignore because they can use their other hand, they can make adjustments. But at times I've had patients come in and their chief complaint is weakness in grip and weakness in pinch. So it depends. Again, it depends. This is a very personalized approach that I have. It depends on what the goals of my patients are. It depends on their hobbies, their activities. So we take a very individualized approach to management of thumb arthritis or CMC arthritis.
One thing you wish every patient knew?
I wish every patient with this condition knew that there were options, non-surgical options that we have at our disposal to help them live their life to the fullest.
And then last one, if someone listening has thumb pain and isn't sure what's causing it, what's your advice on when they should seek evaluation?
I would say that if their thumb pain is bothering them on a daily basis or every several days and interfering with their life, they should absolutely come see me. If they have an awareness of pain at the base of their thumb or an awareness of a bump or deformity, they should come see me so we can talk about the condition, talk about options, and try to help them live better and without pain.
All right, that's going to end this episode about CMC arthritis. Thank you so much, Dr. Shearin, for coming on.
Thank you, Olivia.
If you enjoyed today's episode, be sure to subscribe so you never miss an update. Don't forget to share the podcast with others who might find it helpful, and follow us on Facebook and Instagram at Tri-County Orthopedics to stay connected. Thanks again for tuning in, and we'll catch you next time.